Mouth ulcers HIV. Mouth ulcers, also known as oral ulcers or canker sores, are a common occurrence in the general population, often attributed to factors like stress, trauma, or viral infections. However, in individuals living with HIV/AIDS, mouth ulcers can be more frequent, severe, and indicative of underlying health issues. Understanding the characteristics, causes, and management of mouth ulcers in HIV/AIDS patients is crucial for both healthcare providers and those affected by the condition. 1. Understanding mouth ulcers in HIV/AIDS. Mouth ulcers are characterized by the presence of open sores or lesions in the oral cavity, including the inner cheeks, tongue, gums, and throat. These ulcers can vary in size and severity, causing discomfort, pain, and difficulty in eating or speaking. In HIV/AIDS patients, mouth ulcers are often a result of the compromised immune system, which makes them more susceptible to infections and inflammatory conditions. 2. Clinical presentation. HIV/AIDS-related mouth ulcers typically present as painful lesions with irregular borders and a red or white base. They can occur singly or in clusters and may persist for days to weeks. Patients may experience burning sensations, difficulty in swallowing, or general oral discomfort. These ulcers can significantly impact the quality of life, affecting nutrition, speech, and overall well-being. 3. Diagnosis. Diagnosing mouth ulcers in HIV/AIDS patients involves a comprehensive evaluation, including a thorough medical history, physical examination, and laboratory tests. Assessing the patient's HIV status, CD4 count, and viral load is essential in understanding the severity of immunosuppression and guiding treatment decisions. In some cases, a biopsy of the ulcer may be necessary to rule out other potential causes. 4. Differential diagnosis. Distinguishing mouth ulcers related to HIV/AIDS from other oral conditions is critical for appropriate management. Common differentials include oral candidiasis, thrush, oral herpes, HSV, and aphthous ulcers. Each condition has distinct clinical features and may require specific treatment approaches. 5. Management and treatment. Management of mouth ulcers in HIV/AIDS patients involves a multidisciplinary approach aimed at addressing underlying immune dysfunction, controlling symptoms, and preventing complications. Antiretroviral therapy, ART, plays a central role in restoring immune function and reducing the frequency and severity of oral ulcers. Symptomatic relief can be achieved through the use of topical analgesics, mouth rinses, and oral hygiene measures. Additionally, addressing coexisting infections, such as candidiasis or herpes, is essential for effective management. 6. Prevention. Preventing mouth ulcers in HIV/AIDS patients revolves around maintaining optimal oral hygiene, adhering to ART regimens, and seeking regular dental care. Educating patients about the importance of oral health and providing supportive care can help minimize the risk of ulcer development and enhance overall oral well-being. 7. Complications and prognosis. Untreated or recurrent mouth ulcers in HIV/AIDS patients can lead to complications such as secondary infections, nutritional deficiencies, and decreased quality of life. However, with timely diagnosis, appropriate management, and adherence to treatment, the prognosis for patients with HIV/AIDS-related mouth ulcers is generally favorable. Close monitoring and ongoing support from healthcare providers are essential in ensuring optimal outcomes. Mouth ulcers are a common manifestation of HIV/AIDS, often reflecting the underlying immune dysfunction and systemic disease progression. Recognizing the clinical features, diagnosing accurately, and implementing appropriate management strategies are crucial in providing comprehensive care to affected individuals. Through a combination of antiretroviral therapy, symptomatic relief, and preventive measures, the burden of mouth ulcers in HIV/AIDS patients can be minimized, improving their overall oral health and quality of life. Continued research and awareness efforts are essential in further advancing our understanding and management of this challenging condition.